committee at Harvard, and the committee invented brain death. The committee did not do studies on dogs or cats or rats. They didn't collect data on human beings. They just invented brain death. And they had no patient data. They had no basic science studies. And I know it's really awful when you know about it. And it doesn't get better. It keeps getting worse after that. Then a lot of people think that brain death means flat brain waves. They're not even required to do brainwave testing. The way they did that, they studied 9 patients, and 2 of the 9 still had brainwave activity. And then they concluded no longer is it necessary to look at brainwaves, so it's not required to look for brainwave activity.
So when they're doing the transplantation on people they say are brain dead,
they're all alive.
They're all alive
Yeah.
and completely recoverable.
They're all alive. You cannot.
So they're harvesting organs out of people who are in some way conscious. They just can't communicate.
It's one thing not to demonstrate consciousness, and then we use words like unconscious. But unconscious does not mean that there's no consciousness. It just means that we do not observe consciousness, and there's a difference. So
it's like a subjective.
Right,
observation.
and whether a person shows consciousness or not does not indicate whether they're alive or dead.
Gotcha.
But pain is one of those things that's real, and we should pay attention to it. But pain is the way that the body knows that something's wrong, and it's a way that healing is. Just because a person can't demonstrate pain doesn't mean they don't have pain. You know, a very good example of that is they give paralyzing agents when they take the organs, so that they don't move and they don't squirm.
So horrible.
And even if they don't move and don't squirm, when they cut on them, their heart rate goes up and their blood pressure goes up, which is the response to pain. But they can't demonstrate that they have pain
Because they're paralyzed. They've medically paralyzed them.
Yeah.
So they can't respond by...
Right.
That's horrible. Horrible.
And it gets really bad if you pay attention to it. So in any event, they invented brain death mainly to get organs, but then also so they don't waste money on treating people who aren't ever going to get a job, who are just going to live and not die. And so to see what brain death is, it's primarily a way to get organs. And the way that brain death works is that they get the clergy and the people in pastoral care and to get involved. And then in organ transplants, they have a designated requester. And a designated requester is usually a very nice person who dresses nice and befriends the relatives. Can I get you a cup of coffee? Oh, I know this has to be terrible on you. We'll do everything we can to help you. And all of that is part of getting them indoctrinated
procurement
to get their organs. And
I need to go take a shower.
see, and you cannot get any organs from a cadaver. Every organ that's transplanted is a healthy organ, and you can only get healthy organs from living persons. You cannot get any organs for transplant from a cadaver.
That's why you don't put it on your license.
And the things I'm telling you is that you are not allowed to hear. And because if you hear it, you will be upset, as all 3 of you are upset. And rightly so, you should be upset, because whose organs do they want? They want the organs from certainly from all children, but especially the people who are 16 to 30, and their life is in jeopardy. If they're unconscious and on a ventilator, they're going to get their organs, and they do everything to get their organs. And once the organs are taken, you can't bring them back to life. And so what they do is they tell the relatives, well, you know, your daughter Sally would really like to do something good, and this is a way to make something good out of this tragedy, or your son, and while they have been getting organs from accidents and gunshot wounds, they now get more organs from overdose of drugs than they do from accidents and gunshot wounds combined. There are 8 deaths a day from overdose in Ohio, and they get their organs is what they want, and so what are they doing? They're giving the policemen the Narcan to counteract the drug, which gets them into the emergency room, but it doesn't save their life. It gets them in the emergency room, and they still get their organs. And so...
It's so diabolically disgusting.
Oh, it really is. See, it's so bad.
It makes sense